Right now we're seeing a measles outbreak as well as highlighting the dangers of whooping cough. While they're two totally different things, they're both vaccine preventable outbreaks. Immunologist Dr. Reena Mehta from Uptown Allergy and Asthma is here to discuss what we need to know about both. Good morning. Thanks for joining us. So there are quite a few measles cases, not in Louisiana, but out there, which is concerning, right?
Very concerning. So far, federal health officials have documented 971 cases in 26 different states. Like you said, fortunately not in Louisiana yet. But, you know, this is a very preventable illness, and it's possible that we start seeing it here as well.
And the problem is you're not seeing people being vaccinated, right?
Correct. So it is a very preventable disease, as we talked about. The vaccine is highly effective. One dose of the vaccine is about 93% effective. 2 doses make it 97% effective. So this is something that is completely coming back because people are not getting vaccinated.
Absolutely. Okay, so no matter how much you tell some people, they just don't trust the vaccinations, and because of that, it was completely gone in 2000.
Exactly. So there's been a lot of false information. We got to the point where we had completely gotten rid of measles in 2000, and now we're seeing it come back. And so it's scary because measles can be a severe illness which causes fever, cough, this horrible rash, and there is no treatment. Once you get it, it's just supportive care.
Yeah. All right. Whooping cough. We've heard of that too. That can't really be deadly, can it? Or is it just aggravating?
Well, it's aggravating in most. It's this cough that lasts for weeks to months. The cough of 100 days is what we call it. It can be deadly in your little babies, your premature or your infants who don't have much protection against it. Now, I will say there is a vaccine for the pertussis illness as well. It's not as effective as the measles, for example. It is about 60 to 80% effective. But that doesn't mean you shouldn't get the vaccine. You still should, because if you do get the pertussis illness, it's going to be a much milder course if you're vaccinated.
And for the little babies, you said at 1 year old is the time the vaccine starts?
For measles, yeah, the vaccination is at 1 year old. So those babies who haven't had the measles vaccine are at risk for getting it and getting very sick. Pertussis vaccine actually starts at 2 months of age within a series.
What are we looking at here? Was that the measles?
Yes, this looks like a rash where you would see from the measles, and it can be widespread all over, internally and externally.
All right, well, good information. You know, the safest thing is to get your child vaccinated. We'll be on the lookout for these things. Luckily, it's not in Louisiana yet.
Measles is not, but pertussis is. We've heard about it in our local schools, so it's just something to be aware of, and to also remember to not only get vaccinated, but also get your boosters, because the vaccine, the immunity can wane over time.
Dr. Reena Mehta, thank you so much.